integration of primary health care with mental health counseling and substance use disorder counseling. It's pretty unique in a way in our area to do it. I mean, there's three different levels to integration of, there's one level of integration where a primary care physician recognizes depression or anxiety in their patient, and they're going to prescribe, maybe not prescribe, but they do know, most know that counseling is effective. But getting a person to counseling is where it drops off. And it's nobody's fault. It's just the nature of the process. And then there's this other level of integration where you're co-located. So, and that's been tried in the past. So you got a doctor's office right down the hallway, counseling office somewhere in the same building. The hospitals have been famous for that, but even then, you might increase the access, but then the coordination of the treatment plan isn't there. So we at Travco of true integration, where I'm sitting in an office right next to a primary care doctor. Somebody's coming in with diagnosed with diabetes, newly diagnosed. And that's a pretty tough diagnosis. It's okay, well, I got to take insulin. Now you got to change a whole lot of other things in your life. All of a sudden, anxiety goes up. And in the process with diabetes, people know something's wrong before the diagnosis, and they're hurting, they're depressed, they're anxious. So you arrive in the doctor's office, and you got a couple things you got to deal with right off the bat. So the doctor's informing the person of it. Then the question comes up, how do I tell my family? How do I make these adjustments? And the denial that goes with it. Well, all I have to do is insulin. No, you got to change your life. And that's where a lot of that falls apart. So I'll be brought right into the exam room, right in with the doc. And we're there. There's a nurse, me, the doc, the patient family, the big discussion. That's called a meet and greet.